Good afternoon and welcome to everybody who's joining us for today's webinar, Using Evaluation Data to Promote Program Sustainability. I'm Kim Keating with James Bell Associates. I'm a Senior Research Associate and a member of the Evaluation Technical Assistance Team that supports Children's Bureau's discretionary grantees. Today's webinar is one of several special technical assistance products that JBA is completing to provide practical information on topics that grantees have indicated over time could benefit them in their ongoing program activities and evaluations. So welcome to everybody, and we appreciate you joining us. Before we begin, I'd like to share a few housekeeping issues that may be helpful as we go through the next hour. First, the phone lines of all the participants have been muted, and they will be reopened later in the session. During the webinar, please feel free to use the chat box feature to communicate with us and to submit any questions for the discussion period. Once the lines have been unmuted for the discussion, we ask that you manually mute your own phones to prevent any background noise while others are speaking. And please be sure to remember to unmute your line when you want to make a comment or ask any questions. If for any reason you encounter any technical problems during today's session, please review the logon instructions, and if you need any further assistance, please send an email to webinar1@jbassoc.com, and that email address also is included in the logon instructions that you received. Finally, we are recording today's session, and it will be posted in the near future online through the Children's Bureau's Child Welfare Information Gateway. And we also will be sending copies of today's webinar out to you after the session. Okay. So getting right started now. The purpose of today's webinar is to discuss effective use of evaluation data in sustainability. And what we hope to accomplish is to highlight the importance of using evaluation findings in your current and future sustainability planning and activities. We'll be looking at some of the available frameworks that may help you identify and highlight data from your own local evaluations that may best support and strengthen sustainability efforts. And then finally, we also are looking forward to allowing time for you to share how you may have used evaluation data in the past or currently are using it for these purposes, for sustainability purposes. So I am particularly pleased to be joined by representatives from two Children's Bureau grantees who have volunteered to share their experiences using data in sustainability efforts. With me today are Jim Henry and Amy Perricone from Western Michigan University. They are respectively the project director and project coordinator for the 2012 Trauma Cluster, which focused on improving access to needs-driven, evidence-based, or informed mental health and behavioral health services in child welfare. We are also going to be hearing later from Maria Ruato and Beverly Glinke, the Operations Manager and Training Director at the North Carolina Child Treatment Program, which is part of the Center for Child and Family Health, and partners with Duke University, a partnership of Duke University and the University of North Carolina at Chapel Hill. Their work is conducted in conjunction with the 2011 Trauma-Informed Practices in Child Protective Services Delivery Project. So I'd like to welcome them as well. Finally, we will be opening the phone lines once again to respond to any questions, and we encourage you very much to share your comments during our open discussion period.
The word sustainability appears on the screen. Beneath it is a quote, "The ability to maintain programming and its benefits over time." Washington University in St. Louis, Center for Public Health Systems Science.
So sustainability of anything requires planning, decision-making, and has an underlying component that there's a judgment, that there is something of value that needs to be sustained. So as we begin today's webinar, I just wanted to take a moment to acknowledge for the variety of participants on the session, to acknowledge the very important work that all of you are doing in the field of child welfare on behalf of children and families. So to begin with a little bit of context for our discussion, in March 2016, the Office of Planning, Research, and Evaluation released an important publication that provided guidance for, particularly for Administration for Children and Families grantees. It's entitled The Common Framework for Research and Evaluation. And this publication was written for a wide range of ACF programs and grants, and offers information on the expectations that ACF has in terms of research and evaluation efforts. I think that the information within the report is beneficial, whether or not you are specifically funded by ACF projects, but certainly for those people on the call who are, it is a very beneficial resource to look into. And a link to the report is provided here, and also we've included it in the resources that will appear at the end of the presentation.
An online link to the Common Framework for Research and Evaluation report is displayed: www.acf.hhs.gov/sites/default/files/opre/ACF Common Framework for Research and Evaluation v02a.pdf.
So whether you're at the outset or in the final months of a grant or a project, the information in the framework, again, probably is something that you'll find very useful.
A quote is displayed on the screen beneath the heading ACF Common Framework for Research and Evaluation. By defining common expectations for study characteristics and clarifying the products that should result from different types of studies, ACF hopes to strengthen research and evaluation in human services, including obtaining meaningful findings and actionable results through a more systematic development of knowledge. Office of Planning, Research and Evaluation, March 2016.
What I would like to do is just quickly, this is an excerpt from the publication, from the framework, and you'll see here that as you prepare to share project results, particularly in the context of sustainability, whether you're sharing it with your funder, with the Children's Bureau, your organization's leadership, or others, the report, again, and the information in this publication can provide really helpful additional guidance on the types of meaningful findings and actionable results that you can present from your own evaluations. And we'll be talking in a little bit more depth as we go along about some good examples of those types of data. So as we know, program evaluation and sustainability are intrinsically linked, actually from the very beginning, from start to end of a grant, beginning with the objectives that are outlined in a project's logic model and in the evaluation plan, and continuing with the data collection activities that are implemented. It is also part of reporting, ongoing reporting that happens during the course of a project and at the conclusion of the project, includes tracking in these reports that, if you are a grantee, are recognizable as semi-annual and annual reports, and certainly any cross-site evaluation reporting that you may be involved in, submissions for those purposes. And then finally, what you document in your final report. Most importantly, the role of data in promoting sustainability is its ability to help you, help all of us communicate the vision, what the initial goals, activities, and results were at the outset of the project and as they evolved over the course of a project. The data also help to provide stakeholders and others who are interested in your projects with a better understanding of the extent to which those objectives have been or are being achieved. And finally, the data lends an overall sense of accountability and credibility to your project's efforts, and really provides that additional support, if that's the right word for it. So, programmatic decisions. Sustainability planning requires consideration of many factors and the involvement of multiple and diverse stakeholders. And evaluation is an important component, clearly, of that overall process because it contributes concrete and objective information to that discussion. So ultimately, the discussion regarding, or the decision, regarding continuing all or part of a program are informed by the answers to these core questions that you see here. So those would include, certainly not limited to, but some of the core questions would be, what was it, what is it that we're working to achieve? What actions have we taken? Have we been successful? If so, in what areas? Should we continue? The ultimate question. And if we are going to continue, what is it that we'll be continuing, and how will we be continuing it? And the answers to many of these questions lie in the data. The data that's needed to engage your current and future funders are in your evaluation findings and results.
A graphic is displayed beneath the heading Answers within the evaluation. The graphic includes 4 rows. The top segment of the first row includes the key question, what are we working to achieve? The bottom segment of the row indicates the associated aspects of the evaluation that provide the answer, the theory of change and logic model, the question, what actions have we taken? And the word inputs appears in the top segment of the second row. The bottom segment of the row includes common inputs, including focused population, service model, staffing, and partner organizations. The top segment of the third row is labeled outputs. The bottom segment includes examples of common outputs, including recruitment and enrollment, adult and child demographics, assessments completed, services delivered, retention and completions, and staff trainings. The top segment of the first row includes the key question, have we been successful? In what areas? And the word outcomes. Common levels of outcomes are specified in the bottom segment, including at the child, adult, family, organization, and system levels.
As is shown here. So if we look at this, this graphic, essentially it's just a simplistic look at some of those core questions. What were we working to achieve? And again, that would, from an evaluation standpoint, that would link back to, in the evaluation, what your initial theory of change was, your logic model, what your inputs and outputs were from the actions that you've taken in the project over time. And also, finally, the extent to which you've been successful. And in the course of evaluation, we're looking at that in terms of outcomes, which may be at both client and program levels. So I wanted to give that kind of just preliminary background, and that also brings us to the final kind of ultimate and largest question, will the project be sustained? Should the project be sustained? And what's important here ultimately is, what do the findings support from a programmatic standpoint? And I think another one of the major questions from an organizational standpoint would be, what decisions will the organization or leadership support? So, so if we just get in the frame of thinking of how our evaluation data will contribute to answering those questions. Looking at this from an evaluation standpoint, also again, data from the process evaluations that may be part of a project you're completing help answer questions such as those that you see here on this slide. For the most part, these are process-related questions. And so the data will help answer which agencies, organizations, or interest groups share interest in the population, first of all, that your project serves. Are there current or potential future partners or stakeholders who are aware of and interested in assisting with sustainability planning or activities? It will help you determine what buy-in was achieved or may need to still be achieved from any partnering agencies or future funders in the course of the grant. And that will help you anticipate what you can expect in the future, or help you kind of focus the data on, focus from what the data shows where you can expect to go in the future. A final consideration might be, have you documented your project outputs and success stories in a way as a marketing tool that will be attractive for existing and potential partners. In the context of ACF-funded projects, and I know that we have kind of a diverse audience on the phone, but the majority of you from the ACF grantee perspective, all of us have final reports. We have semi-annual progress reports along the way. The point here and the takeaway here that I just wanted to emphasize in terms of sustainability is that the reports are informing yourselves as well as whoever your ultimate audience is. So often we think of reporting, we get bogged down in thinking of what it is that others need in our report. But if we think of the data and sustainability, what the data is telling us through ongoing reports, and use that for ourselves, it will help to better describe what actually the impacts are on the populations that you're serving, the clients that you're serving, and also give you information about impacts at individual agency, organizational, and even community levels. So beginning with this slide, I'm going to be drawing on some examples, some concrete examples from the work of the 2012 and 2013 Abandoned Infant Assistance Grantees funded by the Children's Bureau. And again, thinking back to the framework, outcomes are those meaningful results mentioned a little bit earlier. And they are both meaningful and also those things that are most interesting, those things that came out of the project work. At the bottom line, what is most important is, of course, how were the children and families changed or impacted, and what the specific project impacts were. So what I've presented here, again, drawing from the Abandoned Infant Assistance grantees experience, is examples of the types of compelling outcomes that contribute to sustainability discussions. And you'll see here things like at the client level, outcomes for these clusters were focused on increases or change in maternal health knowledge, improved environmental stability for mothers and for their children, improvements in the prenatal health of mothers, again, which links back to the outcomes of their children once born, and the reduced number of infants born with substance dependency. At the program level, some of the common outcomes from those grantees were identification and enrollment of mothers earlier in their pregnancies, and that for some it was because of new partnerships that the grant was able to help them develop. And others were streamlined referral processes and linking families to additional supportive services, or linking them sooner. And again, the earlier those linkages were made, the better the outcomes for the children and families served. So to give some additional examples of the outcomes and beginning to think about presenting and interpreting findings, I wanted to look first at the presenting part of that, and that would just primarily be describing the overall impact of a project. So here, what the focus is on highlighting significant differences between the outcomes of adults and children who may have been engaged in the project, and comparing that with those who were not. So in quasi-experimental design, it might be that your data is organized by showing the differences between comparison groups and those who received treatments or various levels of treatments, and of course in a random control trial, it would be comparison to the control group families. What's most important is that where you cannot demonstrate that there was statistical significance in terms of the differences between these groups, you can still describe emerging trends and the direction of the change, and that in itself is valuable information and a product of your evaluation. And we'll kind of link back to that. I'll link back to that in a moment to give you a sense of where that fits in terms of sustainability. We know, too, that many of you doing this work in child welfare have many audiences that are interested in your project outcomes. They are very diverse audiences in a lot of instances. And so what we're presenting in this slide is essentially just the importance of being aware of the various audiences, the different stakeholders, and tailoring the data that you present to the interests and needs of each unique audience. And the same would be true of the formats that you choose to report and dissemination information to for outside stakeholders, not just the funders. So it is important to specify as well your unmet needs, and this kind of gets to the point of the ask in sustainability. So what the thought process is that going into what specifically are the areas where further work is needed to achieve a goal, or where additional partners may be needed to diminish barriers. So on this slide, I've taken a guess at the first two. I put a little check mark next to that because I felt really confident in working with grantees over the last several decades that most of us want more money and most of us can use more time to achieve additional, more of our objectives. And that's part of what we're looking at in sustainability, and certainly that is not the limitation. So I just provided here some examples, other common examples based on what a project components were that may be considered too. And these all, again, this will stem back into what the ask will be for your prospective funders or others whose buy-in you want. It could be, if you had a training program, it might be that you need additional staff training, or you want to purchase different curriculum or expand a curriculum. You may need just additional staff as it is, and so part of sustainability planning is what those numbers may look like in terms of additional hiring. based on the interventions that you have put in place or that a project puts in place, it may be that there are modifications to that intervention that, given additional time, given additional support that would sustain the project, there may be modifications that could be made or adding of new interventions. And you'll see here some other examples too, based on, that are kind of specific to how projects are organized, but many are collaborative efforts, so it may be important to have the opportunity to bring in additional partners, which you've identified through your project work as, and through the evaluation as important factors in moving a little bit closer towards your intended outcome. Excuse me. So those are, I've included a few more examples here, but I just want to kind of move us along to the next slide. And here what I wanted to do was just kind of emphasize, while all of us strive for perfection and hope to achieve all of our goals and outcomes as initially planned and intended, we don't always have things go as we had planned. And because that's the case, it does not mean that we don't report what did not go as planned, because in the context of sustainability and also in the context of planning for the future, those lessons learned and the information that you gain out of what was not achieved is equally as important. So you'll see here from an internal standpoint and also from external standpoint some of the beneficial ways that you can apply less than positive information or things that, that might actually be unmet goals and negative findings. So from an internal standpoint, negative findings can help highlight areas of those additional needs that we've been talking about. So time, training, funding, additional resources that you want to address in the next stages of your work. And examining the unmet goals can also help prioritize the objectives that you still want to pursue. So these are considerations from both internal and external perspectives.
A transition slide is displayed with the heading Perspectives from the Field.
Having said that and given that background, what I'd like to do now is give you an opportunity to hear the experiences of two Children's Bureau's grantees, those who I mentioned at the outset of our time together, whose experiences I think really demonstrate the role of data in sustainability. So first, we'll begin with Southwest Michigan Children's Trauma Assessment Center, which is based in the Western Michigan University. Again, we have with us Jim Henry, the project director, and Amy Perricone, the project coordinator, to tell us about their experience and their successes in using using evaluation data for sustainability purposes. So, Jim, with that, we can turn it over to you.
Okay, and can I move the slides, Kim, or are you going to move them and I should just tell you?
Yes, you can move the slides.
An introductory slide is displayed that includes the program name, grant affiliation, speakers' names, and titles. Southwest Michigan Children's Trauma Assessment Center, Western Michigan University, 2012 Trauma, grant number 90CO01098. James Henry, project director. Amy Perricone, project coordinator. James Henry is a speaker for Western Michigan. He begins the presentation by introducing himself and his colleague, Amy Perricone, the project coordinator.
All right. Great. Thanks, everybody. This is Jim Henry, and next to me is Amy, and I'll be doing most of the talking, but we both have been intensively involved in this project. And so when Kim was talking about the key questions to ask, and the first one was, what are we trying to achieve? And so our ACF grant from 2012 was really looking at trauma screening, trauma assessment, and secondary trauma. So those were the, what are we trying to achieve is to expand screening. And if you look at that first slide there, which I can't, oh, here it is, excuse me, which I'm going to move now. Second slide, the use of data to implement sustained trauma screening. So our goal was to have statewide screening at the end of the 5 years. We started, as you can see in this first slide, with, at the time, only one county had been screening for trauma, and in 2010, our trauma center had created a trauma screen, a one-pager, one for kids 0 to 6 and the other 6 to 18. And so one county had been using that trauma screen in the state of Michigan, where we're from, obviously, was interested in learning about trauma screening and had signed on to the grant, but this was in the very infancy stages of interest. And as a part of this larger picture, just to say that at the time we had been working through our SAMHSA grant with several counties, and that's why this county had been trauma screening to bring about trauma-informed systems in child welfare. And just to give a little background, I had spent 17 years in CPS prior to getting my PhD and co-founding this trauma center that ultimately has the grant, and we do trauma assessments on kids. So with one county starting, and we used a model of a breakthrough series collaborative, really expanded by Jan Markowitz, who's one of the key writers in terms of how to look at this in the child welfare system using a breakthrough series. And so we did that breakthrough series collaborative with one large county, Genesee County, which was in Flint, which obviously many of you recognize as now with the water crisis has just further experienced great adversity in that county. So we worked with a large number of CPS, foster care, and community mental health to get the process of trauma screening to get to trauma assessment. And so from that, after spending a year and learning, we learned a great deal about challenges between CPS and CPS, foster care, and CMH in terms of when they do start screening, what happens. At one point, we had data to indicate that in the first 4 months, there were 19 screens sent over to community mental health, but only 2 ended up receiving any kind of assessment. And so we really looked at that data and found that there was this, we could get CPS foster care to start screening child welfare cases. What was the next step in terms of getting CMH, community mental health, to do trauma assessments? And so this was a huge revelation as to when we started screening and now had multiple kids screened, that there was increased frustration because of the fact that so few of them were getting assessment. So going through this slide, then we moved to 17 counties in the Breakthrough Series the following year to kind of build on what we learned in Genesee in terms of the challenge of assessment and the challenge of screening. How do we get invested in that? And then in the following year, we've done a learning collaborative based upon, again, what we learned in the first 2 Breakthrough Series about the challenges of screening, the challenge of getting trauma assessment, and ultimately looking at how do we address secondary trauma, again, appreciating the impact of trauma screening and trauma assessment on the caseworkers and clinicians. So, again, just kind of moving forward and looking at data use and how this really was very successful is that through years 2 and 3, there are now 49 counties routinely screening trauma using the trauma screen that I mentioned from our trauma center. That over that 3.5-year period of this expansion from 1 to 49. And if you go to the next slide, if you look at the next slide, and that is
A bar chart is displayed, labeling screening data, number of traumas experienced. The sample sizes for the two age groups studied are indicated above the chart: 317 children ages 0 to 5 and 709 children ages 6 to 18. The first bar represents children in the 0 to 5 age group, and the second bar represents children in the 6 to 18 age group. The x-axis indicates the number of traumas experienced by a child and is labeled with values of none through 7 or more. The y-axis is labeled in increments of 5, from 0 to 25%, and indicates the percentage of children within each age group that experience trauma. The average number of children in the 0 to 5 and 6 to 18 age groups that had not experienced trauma is comparable, 2.8 and 3.9 respectively. The percentage of children experiencing 1, 2, or 3 traumas was higher among younger children, with 20.8% of children ages 0 to 5 experiencing 3 traumas, compared with 14% of children ages 6 to 18. The number of children experiencing 4 or 5 traumas was similar across age groups. Approximately 18% of children had 4 traumas and 13% had 5 traumas. More children aged 6 and over had experienced 6 or 7 more traumas, with 22.8% of children in this age category experiencing 7 or more traumas, compared to only 10.9% of children ages 0 to 5.
How we use the data. So this is a slide of 1,000 kids from both CPS and foster care, and the blue columns are kids 0 to 5, and the red ones are 6 and over. We presented this data to the state office, and we have a centralized system in Michigan to leverage their support for the importance of why we should trauma screen and what we might do with this. So basically what you see here is the significance of the number of potential traumas. And the first section of the trauma screen is potential traumatic events for a kid in child welfare. And basically in the red, if you go from 3, in other words, there were 3 endorsements made by either CPS or foster care of a child of potential trauma events all the way to 7 or more. And what you have is about 76% of the kids had at least 3 or more potentially traumatic events, and that 22.8% of the older kids had at least 7 or more. So the state was extremely interested in being able to identify trauma as a need, and the screen provided this data that we collected, because we had all the screens from the counties come to us. We put them on a database, and that data served to really shift the need to be able to say we need to identify these kids. This is a simple way to do that. It's only a one-pager. The caseworkers gave significant support for the screen, saying it was doable, it was helpful. If you go to the next slide, what we used is a combination of that data as well as the testimonials from staff and directors of the value of the screening to operationalize trauma-informed care. And then we had regular contact with state officials reporting on the outcomes of the Breakthrough Series and Learning Collaboratives. Out of that, and this slide unfortunately is worded wrong, in the second bullet it should say, we didn't mandate statewide screening. The state mandated statewide screening using the trauma screener that had been used or is being used in the 49 counties, so that they have just given us a contract. It's not about us, but the point of it is that they gave the contract out to say we want screening statewide. So they've now mandated trauma screening that over the next 2 years they will put in my SACWIS to institutionalize and to sustain trauma screening in child welfare. So this was a process, again, of one county to statewide screening based upon conversation, testimonials, the data from the trauma screens, and the impact in terms of, for the state to say, we want to move in this direction, and this is the first step we can make in creating trauma-informed systems. The second set of events that happened with this, which is not here, but I just want to mention briefly, is that we then, given the data we found in the one county about how difficult it is to get CMH to do trauma assessment in a very comprehensive neurodevelopmental way, which we, in our center, when we started in 2000, now we've done about 4,000 kids in that model. And so the state decided to adopt that model statewide and then utilize 10 trauma assessments across Michigan that were bid, and we were one of those. And to be able to say, we want more assessment for our kids, because if we're going to screen, we've got to follow this up with a more in-depth trauma assessment. So there was definitely this kind of moving forward to say, how do we meet with this and do this, recognizing simultaneously that we've been working with CMH and they've been a great partner in trying to expand their process to include more trauma, yet really confined by time and bureaucracy and policies that make trauma assessment very difficult to implement in their system. The last part of this, as far as data goes, is that we were really focused, as I said, on implementing secondary traumatic stress and strategies to manage that and organizational stress in our model, our theory of change, believing that if we don't address STS and organizational change, that the quality of service significantly decreases in terms of our kids and families. There is high worker turnover, which we all know about, and that in order to maintain a positive workforce, STS and organizational stress have to be identified. So quickly, we worked with all the counties in the BSC and the Learning Collaborative, which basically is 34 counties, on implementing secondary trauma trainings, which we did in all those counties. Secondly, we also utilized a trauma assessment tool that was developed by several of us across the country, led by Ginny Sprang at University of Kentucky, to measure what the office was doing organizationally to address STS and organizational stress. Outcomes of this, the next slide, are that the state now, because of the data, and I'm going to say this, that the pre-test, post-test data from our work with those counties showed a statistically significant decrease in secondary trauma, a statistically significant increase in workforce resiliency. And so based on those findings and pilots that Amy and I had done across Michigan, the state just released a secondary traumatic stress and organization, culture, and climate contract, which we will also be doing to train STS and strategies to manage STS and organizational culture and climate, to build organizational climate and strategies to manage that in every office in the state of Michigan. So in conclusion, again, making this very short, in conclusion, looking at sustainability, we've been very fortunate to use data, both quantitative and qualitative, to demonstrate to the state the value of screening, the importance of trauma assessment, and certainly secondary traumatic stress, to leverage funding because of how they now view this as important to meeting the needs of their kids and ultimately building a resilient workforce. So with that, I will stop. I know my time is limited, so I'm sure if there's questions, we can address those. Thanks, Kim.
Well, thank you very much, Jim. That was a wonderful description of all that you have experienced there and the benefits from it. What I'd like to do is hold questions right now so that we can get to our second presentation, and then after, we're happy to discuss. So if you have questions for Jim, please hold on to those, and we'll talk to them after. So now I'd like to turn it over to Maria Ruado and Beverly Glinke at the North Carolina Child Treatment Center.
An introductory slide is displayed that includes the program name, grant affiliation, speakers' names, and titles. North Carolina Child Treatment Program, Center for Child and Family Health, Duke University, 2011 Trauma. Grant number 90CO1058. Maria Rudo, Operations Manager. Beverly Glenk, Training Director. The first speaker is Maria Rudo.
If I don't have the name right then.
Thank you, Kim. We are so excited to hear about the screening efforts going on in Michigan. That's really great to hear. What we do at the North Carolina Child Treatment Program is work on dissemination of the treatment side. So I'll go ahead. I actually want these in a different order, so I'll jump to this one. So the North Carolina Child Treatment Program was founded in 2006, and essentially what we do is train mental health providers across the state of North Carolina in evidence-based intervention for treating trauma in kids. So an active and informed referral base is wonderful to the work that we do. And so basically we're dedicated to bringing cost-effective mental health interventions to infants, children, and adolescents across the state, and we do this through the dissemination of right now 4 models that we're training clinicians on around the state. So we really liked your evaluation plan slide, and so we decided to just steal that to orient our presentation. So I've given you a little bit of an overview on what we're working to achieve. The actions that we've taken so far.
A slide is displayed that reports services or activities implemented by the grantee by year. 2006 Trauma-Focused Cognitive Behavioral Therapy. 2007 Public Roster of North Carolina Child Treatment Program, NC-CTP, Trained Clinicians. 2009 North Carolina Performance and Outcomes Platform. 2013 Structured Psychotherapy for Adolescents Responding to Chronic Stress. 2014 Parent-Child Interaction Therapy. 2014 Child-Parent Psychotherapy.
Since our inception in 2006, we've implemented 4 different EBTs that we train on, and we've also implemented a public roster of NCCTP trained clinicians, and this is a place where referral sources and families around the state can find clinicians who've been trained in one of our EBTs. And then we've also implemented a performance and outcomes platform, which is basically almost like an EHR that our clinicians record all of their data into so that we can have access to all of our outcomes in real time. Our EBT dissemination is built around the integration of measures at pre and post, and Beverly will talk a lot more about that. We also have some measures that happen throughout the training period and the treatment period, and so we're working on building out this NCPOP platform to comprise multiple models so that we can have the most robust data set possible on how exactly are these EBTs serving kids in North Carolina. So data is really at the center of what we do as we are specializing in EBTs.
A bar chart is displayed under the heading Clinical Outcomes for one cohort of TF-CBT. The cohort sample size is 91. The title of the graph is Pre-Post Treatment, Mean University of California, Los Angeles Post-Traumatic Stress Disorder Reaction Index Subscale Scores. Caregiver Report. The first bar represents pre-treatment assessment score, and the second bar represents post-treatment assessment score. The x-axis indicates the 5 subscales of the University of California, Los Angeles Post-Traumatic Stress Disorder Reaction Index that were assessed. Re-experiencing symptoms, avoidance and numbing, increased arousal, alterations in arousal and reactivity, and dissociative symptom scores. The y-axis depicts reported mean scores in increments of 3, ranging from 0 to 15. Reported scores on all 5 subscales indicate improvement from pre-treatment to post-treatment. Pre-post-treatment score changes were most pronounced for 2 subscales: increased arousal, 13.51 pre-treatment, 7.05 post-treatment, and alterations in arousal and reactivity, 12 pre-treatment, 6.78 post-treatment.
So Beverly will talk to you a little bit about how we've been successful and how we know that.
Yeah,
So looking at what Kim's slides and the different levels of outcomes, so I'm going to give you an example of 3 levels of things we look at. So one thing we look at to judge success is clinical outcomes. So we train clinicians, and they have to complete 2 cases in TFCBT during the training period, and we collect pre- and post-assessment measures. One of those, we have a battery of about 7 assessment tools that we use, and one is the UCLA PTSD RI. And so I've given you a snapshot of one of our cohorts. We're getting ready to start our 16th cohort, so we have quite a bit of data. So this is from the DSM-5, and you can see I've given you, this is the caregiver report, and you can see the subscale, so you can see change. And this is really meaningful for us with our stakeholders and our funders because they can see that change is happening at the client level. Oops, it didn't go forward. There we go. Okay. Another area where we look at outcomes is clinician outcomes. And I was just going to give you one way we kind of look at this and we report on this is, are people actually sustaining the practice throughout North Carolina? So on our roster of clinicians who have graduated with us, every year we reach back out to them and see if they are still, if they still have an active caseload or actively accepting referrals. That way we can also keep up with updated contact information, which is very useful since we do publish this on our website, and people use it to find the trained clinicians in the state trained with us. So right now we have 547 clinicians, TFCBT clinicians, still providing TFCBT. So that is a marker for us of the sustainability. Skip 2 slides. And lastly, I was just going to give you an example of an organizational outcome. So like Jim said, we also use a learning collaborative to do our dissemination of TFCBT. And we have a senior leader track and agency leadership, so mental health agencies in the community, their leadership comes to our training with their clinicians. 1 or 2 agency leaders are usually selected to come. And we talk about 3 main areas of change within their organization to help implement and sustain the EBT. And one is client and family engagement, clinical practice, and agency support and capacity. And then we do monthly consultation calls with agency leadership, and they can focus on an area to work on. We give an organizational assessment, readiness kind of assessment before the collaborative, and that kind of pinpoints areas where they might want to kind of focus their efforts. As an example, in client and family engagement, again, people, as an example, look at retention rate, and then we help them kind of find one thing to change that might improve their retention rate throughout the collaborative. It could be something very small, like one clinician does one thing differently, and then they see if that works, and then they might add a second clinician. So that's something they might do. For agency support and capacity, we also talk a lot about STS, and actually we use the same measure that Jim was talking about earlier. We use the STSIOA and really encourage the agency leaders to think about it for their entire agency and working on that. So those are our outcomes.
Great. So thinking about whether or not we should continue what we've done, seeing such great outcomes in TFCBT, which was the first EBT we began training in, we added a 2nd cohort per year in 2014. So we're now training around 120 clinicians a year in TFCBT. And we've also added expanded rostering criteria in summer 2017. So we'll have, our roster will go from a single level of people who we are still in touch with, who we know trained with us and who we know are active and in good standing, to that level, and also a 2nd level of people who are committed to ongoing clinical quality improvement, which is a program that we're launching this summer. Just because we're seeing such great outcomes with this program, we're looking at ways to expand it and make it stronger. And then, as Kim said in one of the very first slides, time and money are the two things that constrain all of the work that all of our great organizations do. And so we're always looking at the opportunity cost across models. So we have TFCBT, we also have 3 other models, which are CPP, PCIT, and Sparks. And each of these models is structured a little bit differently in terms of faculty time, the duration of the learning collaborative, the number of face-to-face days, and the number of consultation calls, which results in a different unit cost per model. And our funding is finite. It's recurring, which is great, but it is finite. And so we always have to consider what is the relative value of investing more in a given model versus another model, and also looking at the landscape of North Carolina and seeing, are there unmet needs that we could maybe start training in a new model, or is there a way that we could target one of our current models geographically to meet a particular unmet need. And all of the data that we're collecting through the measures that our clinicians are filling out during their training, but also just sort of our reach and the demographic data that we pull from other sources helps to inform these decisions along with the cost structure that we're always looking at. So this is kind of our 30,000-foot view of the way that we're using data in our program, and so we'll turn it back to the main presenters, and I think we'll also be happy to take questions at the end.
Great. Thank you so much. That was another very good depiction of use of this information, use of data, and I really appreciate in both the examples from Michigan and from North Carolina. I think that it really illustrates the not the complexity, but the potential in conversations and in thinking about sustainability beyond just the initial, how most of us may begin thinking of it in terms of money. I just need to make sure I find an additional funder, but there's so much that goes into it, and funding isn't the only thing. And I think I really appreciate both of your presentations to the extent that they really illustrate all the various considerations, and it's not just an issue just about money. It's about how do we do our best, how do we take from what the data shows we do best, or where we have those unfulfilled needs, and take it to the next level and continue to benefit the clients that we serve. So thank you both of your programs for those wonderful presentations. What I would like to do is I just have that summary slide here before I open the phones up for conversation and any questions that you may have. I think, again, we've seen from what we've heard in our presentations how effective data can be in helping to fulfill these objectives of communicating your vision, your ongoing vision, even as it changes and grows, how it can be used to give your stakeholders and funders a deeper understanding of what it is that you are doing and want to do in the future, and certainly strengthens your credibility and accountability, as we said at the outset. So with that, I would like to open up the phones. We can do that here on this end. You now have the capability, if you could just manually mute your phones if you're not making a comment, that will help. But does anybody have questions or comments for either grantee program or for myself? We'd love to hear your comments.
Hi, this is Tiffany from Clark County, Nevada. I just wanted to know if the PowerPoint used in the presentation will be made available to the attendees.
Yes, thank you, Tiffany. It will be made available probably within the next day or so. It will be sent out to you, and also it will be posted along with the audio on Child Welfare Information Gateway. So thank you for your question.
Awesome. Thank you so much.
Mm-hmm. I think there was a question, and also a question about how can we get a copy of the trauma screening checklist. I'm not sure which of the two grantee presentations that fell under, but
that would be ours. And Kim, we can email you if you want to then send it out to everybody else. We can do that when we get off the phone. How's that?
That sounds wonderful. Sure, thank you.
All right, so we'll get that out. Yeah.
Okay, I appreciate that. other questions and comments?
Yes, hi, this is Claudia Berry from Healing Place Serve in Baton Rouge.
Hi, Claudia.
And hi there. I had a question about the organization outcomes. I'm a little more familiar with client outcomes and the need to be measurable. But it didn't seem as though the organizational outcomes were as measurable. So could someone address that?
Yes, that's a great question. And actually, this is one we've really struggled with. In the past, we've just used a lot of really process data, just talking about that we do the consultation calls with the agency leadership and maybe documenting which domain, like is it, when we talk to the organizations, are they working on clinical practice or are they working on family and client engagement? But we've recently started using an organizational assessment, which is scored. So we are still kind of piloting this, and we just recently got our post scores from our first cohort using it. So hopefully we can see if we can get some quantitative data on that.
And we use the SPSI that both the North Carolina program and ourselves, and that's just was created about a year ago, and we found that it's a very good measure to look at, again, psychological safety, resiliency, organization, culture and climate. So that's one of the ways that has been helpful to feedback that to the organizations to really recognize there's a problem, there's an issue not being addressed. How are we going to do that?
Did you give the name at the beginning of that? I missed it.
It's in the slides, and when you get the slides, it's under mine. I have it listed and cited, so you can get that. As a matter of fact, I will also send that out to Kim, and then you can send Kim that out to everyone.
Sure, I'd be happy to do that. Was that the SPSI, I think, is what
Yes.
You had called it? Okay.
Yes.
Thank you.
Perfect. Thank you for your question. Other questions and comments? I know that we're coming up pretty close on the hour, but I really wanted to give the time to our speakers, our presenters, because of the richness of the information that they were able to present, and whether or not you're also a trauma grantee or have other initiatives that you're undergoing. I think that their points really illustrate things that can be applicable across projects. So if there were a few more questions, we can take those for comments. Any others? If not, based on the hour, it's 4 o'clock. What I'd like to do is, again, thank you, Jim, Henry, and Amy in Michigan. I'm tongue-tied at this hour of the day. I apologize. In Michigan. And
thank you.
Maria, thank you. And Maria and Beverly in North Carolina.
Thank you.
I appreciate you very much participating in this. It really has made it very worthwhile. I would like to point out that we do have a resource slide. It's minimal, but there are three good resources there, and we're always happy to speak with you all individually, anybody who would like to follow up more on this topic. And again, we will be distributing the slides and the webinar presentation within the next day or so to you individually in your email boxes.
Resources: Office of Planning, Research, and Evaluation, OPRE, the Administration for Children and Families Common Framework for Research and Evaluation, OPRE Report 2016-14, March 2016, available at http://www.acf.gov/sites/default/files/opre/acf_common_research_and_evaluation_v02_a.pdf. Center for Public Health Systems Science, Project Sustainability Assessment Tool, George Warren Brown School of Social Work, Washington University in St. Louis. Available at https://sustaintool.org/understand. James Bell Associates, Children's Bureau Discretional Grant Programs. Suggested outline for grantees. Final evaluation report. Contact KEATING@jbassoc.com.
So with that, I would just like to say thank you to everybody. I appreciate your participation, questions, and comments, and please enjoy the remainder of your afternoon. Thank you very much.